What's the breaking news?
Yeah, this is some pretty vital information that's being reported. Just really quick to set it up. Last week on the High Wire here, we spoke about this talking point that emerged out of nowhere, 18 months or longer for restrictions, for self-quarantines until a vaccine's ready. A lot of the media ran with that. That was traced back apparently to an Imperial College of London report based on assumptions. The report was done by a British epidemiologist named Neil Ferguson. He's the head of the Department of Infectious Disease Epidemiology in the School of Public Health at the Imperial College there. Well, just now reporting the Daily Wire headline reads, "Epidemiologist behind highly cited coronavirus model admits he was wrong, drastically revises model." Now, this model informed government policy decisions in the U.S. and the U.K. So Ferguson basically just gave us evidence in the U.K.'s Parliamentary Select Committee on Science and Technology as part of the nation's coronavirus response. So going back to the Daily Wire report, Ferguson's model projected 2.2 million dead in the United States and 500,000 in the United Kingdom if no action was taken. The Daily Wire writes, after just one day of ordered lockdowns in the UK, Ferguson has changed his tune. Now the epidemiologist predicts hospitals will be just fine taking on COVID-19 patients and estimates 200,000 or far fewer people will die from the virus itself or from its agitation or other ailments. So we have 500,000 goes to 20,000. The article continues. It talks about an author and former New York Times reporter, Alex Bernison. He says, quote, "This is a remarkable turn from Neil Ferguson, who led the Imperial College authors who warned of 500,000 UK deaths and who has now himself tested positive for COVID," stated Bernison. He now says both that the UK should have enough ICU beds and that the coronavirus will probably kill under 20,000 people in the UK, more than half of whom would have died by the end of the year in any case because they were so old and sick. This is his words. Now, what's interesting here, the Daily Wire writes that just days before Ferguson's about-face, Oxford epidemiologist Sunitra Gupta criticized him, saying, quote, "I am surprised that there has been such unqualified acceptance of the imperial model." Now, Gupta herself has a model that is basically suggesting that the virus, the COVID virus, was circulating in the UK by mid-January, around 2 weeks before the first reported case and a month before the first reported death. Her Oxford model is claiming that half of people already have it. So back to the Daily Wire. So it says, quote, "If her model is accurate, fewer than 1 in 1,000 who've been infected with COVID-19 become sick enough to need hospitalization, leaving the vast majority with mild cases or free of symptoms." So in other words, Ferguson's highly influential initial model was off by orders of magnitude.
At the moment is that maybe 1% of people who get infected might die.
And in a mortality rate of 1%, that's 400,000 people.
Potentially. I would emphasise that at the moment, putting numbers like 400,000 isn't necessarily helpful because we have so little information.
But it's not an absurd number.
It's not an absurd number. No.
Are we overreacting?
I would much prefer to be accused of overreacting than underreacting, let's put it that way. And this virus is the one which probably concerns me the most of everything I've worked on.